Shawn McAnalley here with Dr. Bill McAnalley, Chief Science Officer of Aroga. Today, Dr. Bill is going to talk about stem cells. Not the kind of stem cells you hear hyped about on TV all the time, about stem cell therapy and this, that, and the other, but this is a stem cell you don't want. These are cancer stem cells. Dr. Bill?
Thank you. I don't know how many times I hear people got cancer treatment and their cancer is gone. And we all celebrated it, took them out to eat, had a wonderful time. And then a few years later it comes back with a vengeance. And this time, the therapy they used before won't touch it. And they're learning what that is cancer stem cells. Like you want normal healthy stem cells to replace healthy cells. But in this case, these cancer stem cells replace the cancer with an immunity to the therapy that killed off all the others. And they're just now really recognizing that, and they're starting to study it. So they're targeting, like in the case of pancreatic cancer, they're targeting it, and they're finding that all of these phytochemicals, they're individual ingredients, because scientists haven't learned how to look at combinations yet.
Mm-hmm.
Like there are a lot of studies just showing that the combination of the ingredients within the plant is synergistic.
Mm-hmm.
They just take one of those ingredients and look at it.
Right.
I'll be glad when they get to where they're taking all the ingredients, the whole plant, and looking at it and seeing what they do.
Mm-hmm.
Because single ingredients do amazing things. And here they list all of these ingredients in complex plants. This is just a diagram showing how these different ingredients from the plants block and kill the stem cells. Food.
That's pretty cool. Yeah, I can see them right here.
Yeah.
No.
And then a novel approach to breast cancer. For a long time, I've talked about this before, doctors say don't take phytoestrogens if you have an estrogen positive cancer. And all the studies show they're wrong. That was just a theory.
Yeah.
And here, there are even major medical centers are starting to say, that we need to give those phytoestrogens.
Mm-hmm.
And this shows that the phytoestrogens actually inhibit estrogen positive cancer in all these places.
Makes sense.
And they've been showing this now for about 10 years, 15 years.
Mm-hmm.
And I guess, since they say it takes 20, 30 years for proven science to be adopted.
Mm-hmm.
That was theoretical science they adopted instantly.
Of course. Oh, goodness.
So, what they're showing is that it's a lot more complicated.
Mm-hmm.
Like here, they're looking at just resveratrol and curcumin and berberine, which are individual ingredients found in our food.
Mm-hmm.
And they show how they activate something we didn't know about until recently, and that's microRNAs.
Mm-hmm.
And the microRNAs kill those cancer cells. They're trying to develop drugs to do that now.
Mm-hmm.
When food does it safely,
Mm-hmm.
as a pharmacologist, I may be anti-pharmacology, but I believe in a lot of the wonderful drugs we make.
Sure.
But we need to remember our drugs came from plants.
Right.
And so here we have just curcumin. All of these are areas that they block stem cells and all those different apoptosis sites.
Mm-hmm. And when you say stem cells, you mean these
Cancer stem cells.
cancer stem cells, negative.
Yes.
Negative.
And this is the way that they kill it. Just one plant ingredient. And the combination, we wouldn't fit on this page.
That's right.
And so, I want people to understand this. And these are coming from major medical centers saying, hey, look what this ingredient does. Let's make some derivatives of it. Well, when you make the derivatives, they're always toxic. We are in harmony with our plants that have been grown, not with the derivatives. And other ingredients like wild yam. And of course, they didn't look at all of them. There's several that are active, and diosyn's the main ingredient they're always studying, but it inhibits stem cell cancers. And milk thistle, this ingredient they picked out, or in this case, they're studying mainly just one ingredient, and it kills cancer stem cells. Here's another one showing the different stem cells it kills. And they're synergistic anti-tumor effects. They can kill gliomas, which is the bad cancer in the brain. When people get it, usually they don't live 6 months.
Oh, wow.
And then when their stem cells, if they do survive it, get it taken out, the stem cells come back, it's bad. And what's working are the different ingredients in these plants. In this case, milk thistle. Here's another. Now what's interesting here is people worry about it competing with the drug. Actually, it's synergistic. It makes your drug work better at a lot lower concentration. I can't tell you how many times I'll know people are taking phytoestrogens against the doctor's will, and I'll say, what's the doctor say? He says, our drug has never worked this good. It is just wonderful.
Yeah.
You're just really special.
Yeah.
Thank goodness you got this drug.
Yeah.
So, anyway, that's what I wanted to present, is that these stem cells are there. And a lot of times after you've had cancer, you don't feel like eating much of anything.
Yeah. Really beats you up.
It beats you up, yes it does. Yeah, I think I'll just shut this off.
All right. Well, hey, guys, I hope that, you got something out of that. And just know that, even cancer is good at adapting, it seems like. I mean, once you fight it with the drugs and win the first time, when it comes back and drugs don't work anymore, And what Dr. Bill showed you here is the plants are already there. The plants do it. The plants give your body the ability to do it itself. Guys, until next time, this is for the health of it.